The case study that I'm going to talk about is Lewis. This patient was admitted because he had lymphadenopathy with a lower extremity ulcer. He has been treated at the wound care center, and he also has lower extremity edema, which is being managed with complete decongestive therapy, which has not been effective for him. Over the last 6 months, he's had multiple episodes of cellulitis of the lower extremities, for which has received treatment. The ulcer has been developed on the medial left leg and has not been responsive to the therapy in the outpatient care. He has slight erythema of bilateral lower calf and shin areas. The patient has a long history of morbid obesity, and he has had chronic lymphedema of the lower extremities for the last 2 to 3 years, which has been mostly non-responsive to the complete decongestive therapy. There is no known cause right now for his lymphedema, but it could possibly be related to the subclinical lymphatic filariasis infection when he was a child and spent 2 years doing ministry work in the Dominican Republic. He has history of hypertension, hyperlipidemia, spastic colon, bilateral knee arthritis, and recurrent cellulitis of the lower extremities. He has had a cholecystectomy in the remote past. The patient lives by himself and has 3 pet cats. He is an ex-smoker. He quit smoking about 5 years ago, and he occasionally drinks a few cans of beers. Both his parents died. Mom died from heart problems, and dad died from leukemia, as well as one of his uncles. Lewis is on 4 different medications. He's on one for high blood pressure, high cholesterol, one for heartburn, acid reflux, and then one that helps with a wide variety of stomach conditions like IBS and stomach ulcers. Looking at his blood work, I wasn't able to see the cholesterol levels, and I couldn't tell where those were on a scale. So I would probably ask for those as a dietitian, just to make sure that we're giving the correct medication. And then he was recommended to do a low-fat and low-salt diet. I believe that there is weight bias. Reading the medical doctor's notes, in his notes when he does the physical examination of the patient, he states that the patient's abdomen is obese, and his general physical examination, he states he's an obese man. And then also when he's talking about his lymphedema, he states it is certainly exacerbated by his weight. Well as when he was talking about his mom passing, he puts in quotes, "She died from heart problems." Now, as a professional, these things I felt weren't stated professionally, and the wordage and phrase that could have been used were fatty tissue or excessive adipose tissue, etc. And if his mom passed from heart problems, I don't think that should have been quoted with quotation marks, just because that made me feel as though that's what he's, stating that it could have been, or it could have been something else. And then when he talked about it, that his weight could be why he's having that lymphedema, he's blaming the weight, even though they know when he was a child, he went through stuff through his ministry work and got sick. And so that could have affected his lymphatic system and has been causing what he's been going through, but it's unknown. So he's stating that, his weight is an issue, which it doesn't help, but I don't think it should be, over and over and over pushed saying that he's obese and that his abdomen's obese. I believe that there could be better wordage when speaking about that. Understanding the destructive effects of weight bias on the patient's, the feelings, and then feelings of judgment and bias is also a factor that can worsen the psychosocial status of an individual and can cause these people to overeat, which also could increase their BMI even more, according to Lawrence in 2021. So when talking to patients, understanding where they're coming from and their lifestyle is so important. And looking over Lewis's 24-hour recall, I'll let you know kind of what he ate. He had grape nut cereal with skim milk, non-fat cottage cheese, coffee, blueberry bar. He had Subway with a 6-inch on whole wheat bread with an apple and Diet Coke. He had pretzels, bananas, chicken breast with kale and butternut squash pudding, and then blueberries and water. So he really met all 6 of those breakfast, snack, lunch, and dinner. And I think that's super awesome that he did that. And I think that's super awesome to recognize him and like talk to him about when it comes to that motivational interviewing part of it. I think when, we're looking at that, I think we can talk to him and ask him, where he's at with, moving his body, what's possible for him, what he can do better in. And then also talking about in his, diet, I see that he has a lot of variety in his diet, and I think that's super awesome to recognize him for and, acknowledge when talking to him, as well as looking and asking him, what things he struggles with, what things he can improve on, and what he is doing good and feels good about. But through this whole case study, I definitely do feel that there is weight bias from that medical doctor in his assessment, because I don't feel someone should be, if they're going to be talking about their appearance and, things that they're seeing with a physical examination, I don't believe anyone should be using the word obese for a label on something, especially as a medical doctor. You should be more professional than that with the way you're approaching it.